The National Healthcare Service in the UK is in far more debt than we possibly realise. £7 billion, according to this from The Guardian. We're going to read more into it, guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is REGANELITE here with an article from The Guardian with the headline that the NHS, our National Healthcare Service, sinks into a £7 billion cash crisis as inflation and strikes are biting it. The soaring deficits as health trusts across England cast doubt on Sunak's waiting list pledge. Guys, this is we already know that the NHS is already in pieces, but when you're looking at such a debt as this, it's quite humongous for a national healthcare service to have such a thing. And how are you going to pay back that debt as well? There's going to be significant changes. We know that should Labour win the next election to our national healthcare service, what that will entail, we won't know until they're in power, because can't really be 100% sure that they're going to. I don't think it's going to be able to be back as it was back in 2010. I do think it's going to be there is going to be privatisation of part of the NHS going forward, but I hope it's rolled back to an extent. But this £7 billion is, it's not good, guys. It's not good. So the National Healthcare Service, the NHS, is heading into an unprecedented financial crisis. I'm going to overspend its budget by at least £7 billion next year as its efforts of inflation and strikes plunge hospital trusts into alarming levels of debt, according to a leaked independent expert. So £7 billion over its budget. Now, yes, some of it is on strike, a little bit is on strikes, but also the strike could have been avoided if the NHS people were given, staff, doctors, nurses, pretty much people from top bottom, given a decent, fair wage. Now, I understand that inflation is an issue, but still doesn't mean that these people should not be given a fair, decent wage so they can actually feed themselves instead of having to rely on food banks. But also, you have to remember that parts of the NHS have been over the last 13 years chopped up and sold to private companies, private businesses. So it's no longer about the health and well-being of people. It's about how can we basically make money out of this. How can we take people's and how can we basically get more money out of people? Because at the moment it is free at the moment, but at some point that's going to change, and the next generation are going to end up having to pay out of their own pocket for healthcare at the rate we are going, and it's a big problem. The problem of soaring deficits is hitting a growing number of trusts across England ahead of a likely general election within 12 months, and will raise further serious doubts about Rishi Sunak's chances of meeting his pledge to cut record waiting lists. He's not going to do that, guys. In a sign of extreme pressures, the Manchester Integrated Care System, bringing together trusts and other healthcare providers in Greater Manchester, has brought in Stephen Hay, a troubleshooter from PricewaterhouseCoopers, who formerly worked in the NHS, to help sort out its disastrous financial position. According to the Health Service General, NHS Greater Manchester has reported a deficit of £125 million after the first 4 months, is 2023-2024, more than £100 million worse than planned. Insiders say they expect a dire state of trustees' finances to be higher than the agenda at the meeting of the NHS board on the 5th of October. While inflation and strikes have worsened the situation, its descended into debt is also traced back years of pre-COVID austerity. The Council's ministers are trying to claw back extra money that they pumped in during the pandemic to deal with the emergency situation. Yeah, all that austerity, guys, that was what really hampered us as well. That should never have happened. Sally Gainsbury, Senior Policy Analysis of the Nuffield Trust, one of the leading authorities on NHS finances, said The English NHS faces an almost impossible struggle to balance its books and cover the cost of care this financial year, as a result of the government's desire to squeeze its budget back down to the levels expected before extra spending during COVID. Official figures suggest the service was already on track by the end of May to overspend its budget by at least around $2 billion. That figure may well worsen throughout the rest of the year as the cost of covering striking doctors and premium rates rackets up. In addition, the NHS as a whole is currently looking at a budget next year of some $7 billion smaller than its current rate of spending. In a further escalation of NHS woes, this week we'll see the first joint strike by junior doctors and consultants, which result in extra costs of employment agency workers to cover and loss of income from cancelled operations. Consultants in England will be striking on Tuesday and Wednesday, with Christmas Day levels to cover, meaning emergency services will continue, but elevate surgeries will be hit. Junior doctors will join strikes on Wednesday. Safi Anavinka, apologies for mispronunciation of the name, chief analyst at the King's Fund, said the NHS finance director I speak to are deeply concerned about how quickly their financial position is deteriorating. Financial deficits in the NHS are real consequences for the care we receive as pressure mounts. NHS providers are facing with decisions with leaving staff vacancies unfilled or cutting back on plans to improve how services are delivered. And as hard as it is to believe, it is likely that 2024-2025 will be even worse as the number of people required care and treatment continues to increase while funding growth starts to slow. It is equally hard to believe that in an election year the NHS will be allowed to hit the buffers, he added. Much of the pressure on funding has come from an estimated £3.9 billion bill from the average 5.5 average pay rise awarded recently to NHS staff. The Department of Health and Social Care was only funded by the Treasury for parts of this, so he'll have to make budget cuts or ask for more. Ask for more is the obvious solution, but he will not. Jeremy Hunt will just keep turning around and say inflation. That's the problem. So, yeah. Saffron Kaur, the Deputy Chief Executive of the NHS provider, said it was vital that the strikes ended soon before more damage was done. There is a danger that industrial action becomes part of trust business as usual. Not only does this underplay the growing impact on patient staff, it also masks the severity of the mounting financial challenges that the NHS is now facing. It won't end unless they're given a fair wage. That's just it. You know, if you're not going to pay them properly, you know, they can keep kicking and screaming all they want, the government, but if they're not going to pay them properly, they need to keep striking. And yes, even if it does come at the expense of patients, unfortunately, because at the end of the day, without a functioning national healthcare service, guys, people are going to die either way. Julian Kelly, the Deputy Chief Executive of the Financial Chief of NHS England, has issued public warnings at several board meetings about the grim financial outlook facing the service this year and in 2024-2025, and said that it may have to cut planned funding in key area care as a result. Last October, Kelly, a former senior civil servant, warned that in the next few years the NHS could have to completely revisit investment in cancer, mental health and diagnosis centres. He blamed high inflation for wrecking NHS financial planning. No, it wasn't high inflation, it was austerity that's wrecked your financial planning. NHS England has also agreed to make unprecedented efficiency savings in return for budget increases from the Treasury. Where are you going to cut? That's not going to kill people. That's my question. The Institute for Physical Studies last year said that the NHS was facing small real-term budget cuts in 2023-2024, 2024 and 2025, partly because of inflation, but also because its current funding settlement was front-loaded to give it more money to help it cope with burdens imposed by COVID. The financial think tank pointed out that if those cuts happen, it would be the first time in the early 1950s that the NHS has faced 2 consecutive years of real-term cuts to its income. In the absence of additional funding or a sharp lower of inflation and cost pressures, the NHS will be asked to do more with less, says Ben Zakaria, senior researcher economics at the IFS. They're already doing more with less. Let's be realistic here, guys. They're already doing more than less. Last week, the government has pledged an extra $200 million towards winter pressures, although NHS sources said it would be used to pay agencies and other staff to cover for striking doctors. The Department of Health and Social Care spokesperson said we're backing the NHS with record funding. The core NHS budget in England is currently at $163 billion and will increase to almost $166 billion next year, the highest spend on the healthcare in any government history. Yeah, you keep saying that, but you're not putting enough in. keep saying high spending, high spending, high spending. You keep saying that, but you're not sorting out the problems. Doesn't matter how much money you put into something, if you're not going to fix the roots of the problems of it, it doesn't matter how much money you throw in. To ensure the continuality of patient service, we provide cash support to trusts in financial difficulty. Trusts also work with NHS England to address the underlying issues, improve performance and manage their budgets. NHS England can deploy the National Recovery Support Programme to provide intensive support to trusts in financial difficulty. But again, we've had, as I've said, guys, they're not investing. Like they invest in money, but where is that money going? Because 166 billion sounds like a lot of money for our national healthcare service, but where is this money going? That's my question. Like, where are the details? Like, they keep saying all the time, whenever things are going wrong, this government says we've invested this, we've invested that, we've invested this, invested that. No details, no details. They never give the details. And the National Healthcare Service is mainly owned by private people now, because it's on the board, on the NHS board. It's mainly private companies now. So where is this money going? That's the thing. Like, it's this nonsense. They keep saying they keep investing. They're investing record money. They want to privatise the National Healthcare Service. They want you to pay out of your pocket for your healthcare. Yeah, so if your mum's dying from cancer, they want you to pay for that cancer treatment. If you've got a serious illness, or if you're in bed on your deathbed and you need an operation that will save your life, they want you to pay for it. This government wants you to pay for it. Let's be clear. Yeah, because if they did care about you, if they had any shred of care about you or I, they would not be sitting there on their backside allowing this to happen to our National Healthcare Service. They'd be paying our doctors, our nurses, and all our other public healthcare services in the NHS England, yeah, with a fair and decent wage. Let's be absolutely clear about this, guys. But they don't care, because if they did, they would have done something about it long ago. And we have a Prime Minister who is filthy, stinking rich, with a filthy, stinking rich wife. And that tells you everything you need to know about the government that we have. They have no understanding what it's like to be on the lower threshold of life. None whatsoever, guys. And all they care about is damn inflation and enriching their friends and buddies. Well, with that rant over, guys, if you wouldn't mind leaving a like, share and subscribe, and leaving your comments down in the section below. Eager to hear your thoughts on what you think of this situation. Do you ever think that the NHS will return to what it used to be, guys? Is there any possibility that we could have it returned more back into state hands? Will the Labour government do that? Will they prioritise the needs of the British people when it comes to our healthcare? Let me know down in the comments below. As I said, like, share and subscribe if you can. It would be really greatly appreciated. Check out some of my links down below as well if you wouldn't mind. That would also be greatly appreciated. Thank you for watching. Whatever you do, take care and goodbye.